She is a disease detective. We know that. She's an epidemiologist. She's also the CEO of the San Antonio AIDS Foundation. We're talking about Cherise Rohr-Allegrini, Dr. Cherise Rohr-Allegrini. Cherise, thank you for joining us. We really appreciate it. Talk about the importance of World AIDS Day, and with COVID and RSV and the flu and all these other things that we're doing publicity on, are we losing sight of the importance of fighting AIDS?
You know, I don't think we are losing sight of it as long as we keep working at it. The World AIDS Day was set up so that we can honor those whose lives were lost to the HIV epidemic, and remember that it's still ongoing. We're 40 years into it and we still have a pandemic. It's a lot different from how COVID and flu pandemics work, but it still is very, very significant. And I think that we think of it differently today because it's not the deadly disease it once was, because we have treatment available. But it's still very, very important for us to acknowledge it, remembering those we've lost, but also how can we prevent new infections in the future?
There are people who have HIV who are living long, fulfilling lives, and you talk about some of those medical advancements. Can you speak a little bit about what treatments are available for people and how that's kind of changed the game here?
It has changed the game. If you get into care very early and stay in care, and that's the critical thing, it's taking medication daily for the rest of your life, you can live a very long, very healthy, very active life. And you get to the point where the virus is no longer detectable. That's what we mean, U equals U. Undetectable means untransmissible. If you get to viral suppression to the point that we don't find virus in your blood, it's not cleared completely, but it's at such low levels that it's not transmitted to another person. That's our goal with HIV treatment, is to get you to undetectable levels.
And is that, people are still dying from AIDS, from HIV AIDS.
Unfortunately, they are.
Yeah, and is not getting tested the reason?
It's not getting tested, but it's also not getting into care.
Right.
So people are hesitant to get tested. And then some people, when they're tested and they get a positive diagnosis, they're hesitant or they're afraid, or because of stigma, they don't get into care. We have care available. And unfortunately, we lost a few patients this year because they did not get linked into care early enough.
You mentioned stigma, along with medical advancements over the last several decades. Has the stigma changed? Has that improved for patients who are no longer burdened by that, not letting the stigma stop them?
Has it improved since 1985? Yes, but it's still such a strong factor. I would say that the number one reason people don't get tested is because of stigma. There's fear involved. They don't want to know, and then they're afraid to do anything once they find out. They're hesitant to have the medication at home because they don't want anyone to know that they are taking medication. They're afraid to talk to people about it. And that's because of the stigma that's still out there and associated with HIV, which is really unfortunate. If we can overcome that stigma, we can really stop this virus in its tracks.
Let's break down some of the myths around AIDS testing, around AIDS medication. How easy is it to get tested?
It's extremely easy. At our organization, we're open 8 to 5, but we're also open in the evenings and on the weekends. We go out into the field. We're out at events. We're out at the bars, the clubs. We're everywhere. And there's a number of organizations in the city that do that, not just us. We perform at SAFE about 6,000 tests per year. And that is probably the most of any of the organizations, but they all perform quite a few. It's very easy to get tested. It's the hardest part, I think, is taking that first step to wanting to go get tested.
Is the test itself really involved? If somebody takes that first step to actually do it, what comes next?
It's rapid, within a minute or two. It's a preliminary diagnosis, but it's a finger prick test. It's very, very quick. That's what we can do in the field. Now, if that does come up positive, we'll do a secondary test with the blood test and send that off to get a better diagnosis, confirm that that is indeed positive, and then also we'll get viral loads to see, how much active virus you have at that time. But it's a very easy test, and in fact, if you get a diagnosis here, we will take you to our clinic immediately, and you can start your treatment that day.
I know PrEP is one of the pills that you can take that helps fight HIV and AIDS. I know it comes in pill form. There are also talk that it may soon be, if it's not out already, in an injectable form, in a vaccine. Are those the two? Are those the two most popular ways that people battle AIDS and HIV?
Well, let me clarify. So there's medication that you take daily, and then we're moving to injectable medications as well to suppress the viral load. That's for if you have HIV. PrEP is actually to prevent HIV infection. So if you are, it's especially important if maybe your partner has HIV or you're just sexually active and you want to take precautions, you go on PrEP. At the moment, what we have, it's a daily medication that you take to prevent HIV infection. There is out there an injectable PrEP, which I believe is once a month at first, and then it moves to once every 2 months. We're not doing that yet. There's some issues with getting insurance to cover it and the protocols that are involved. And this is very, very new, but that is the direction we're moving.
Cherise, before we let you go here, just going back to that issue of the stigma, whether somebody has someone in their life who is dealing with HIV or not, what message do you want to send to everybody watching this about some of the biggest misconceptions about HIV?
Oh gosh, there's a lot of misconceptions, but HIV is very, very treatable. It's not curable, but it's treatable. We can get it to manageable levels where you can live a long and healthy life. And having HIV doesn't mean that there's anything wrong with you. There's nothing bad about you. You didn't do anything wrong. You coming to SAFE or to any place to get tested is a way to take charge of your health. We applaud people that come in, and there's no judgment. There's no shame. We're here to support you. You're part of our family once you walk in our doors, and share that with your community. I realize a lot of people don't want to talk about it outside our doors because it's a scary topic. It's an uncomfortable topic, but normalizing it, talk about sex, talk about how to prevent infections, make it normal. That's the most important thing.
And I hope we're taking a step in doing that today by having this conversation and talking about and breaking down some of those myths.
Mm-hmm. Absolutely. Thank you for having me.
Yeah. Cherise Rohr-Allegrini with the San Antonio AIDS Foundation. Thank you so much, Cherise.
Thank you.
We'll be right back.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.